Thank you, everyone, for joining us today. My name is Jess Molesky. I am the benefits specialist here at the consortium. Today with us, we have Rachel Buckwalter, Director of Community Health from Tompkins County Whole Health, who is going to share information about tick bite prevention. Thank you.
Hi, everybody. Thanks for having me today. I'm going to share my screen here and get going with this presentation. Just to let you know a little bit about my role here at the county, the division that I direct, Community Health Services, includes communicable disease surveillance for the county. So we do a lot with data and looking at numbers of diseases that are found here in Tompkins County. Can you guys all see that presentation?
Yes.
Okay. All right, and then I'm just gonna swap. Okay, and now you all should just be seeing the presenter view, not the background view, right?
Yes.
Okay, cool. All right, so tick-borne infections, how can you protect yourself? And I'll just give a little disclaimer at the beginning here that I'm really focusing on prevention. I am a nurse by training. I'm not a physician, so we don't diagnose tick-borne infections here at the county. We just get the data on how many cases there are. We're happy to advise providers who need help with treatment decisions, but when it comes to like ordering tests, ordering medications to treat, that's not our role. Our role is the surveillance, education, prevention. All right. And the next slide is not moving ahead. Oh boy. There we go. Tick-borne infections are on the rise. So if a lot of you follow news and public health in general, there have been more tick-borne infections in recent years. We keep finding new ones that ticks can transmit. The geographical range of ticks is expanding due to climate change. So colder areas have more warmth more times of year, and so there's more tick activity, which leads to more tick-borne infections in humans. And there has been some data showing that 2026 tick season is already off to a bad start. There's some national data from CDC. We also have local data, which I'll show on the next slide, that ER visits for tick-related concerns, tick bites, are triple the typical rate at this time of year compared to previous years. I did see some thoughts on that we had an unusually cold winter here in the Northeast, right? A lot more snow and cold temperatures than we've had. And actually what that does is it insulates the ticks even better. They just like burrow under all the snow and cold, and then they come back out ready to bite, I guess. All right, so we're gonna actually look a little bit at local data, and then we have a poll for you. I'm just curious to hear from people on the call as to if you've been diagnosed with a tick-borne illness. They're so common these days that I'm guessing that some people have had personal experience with this. If you're interested in data at the local level, you can go find, this is our website on our Whole Health site related to tick-borne illness and data. And it was just updated. I grabbed these screenshots this morning with data from April. So we are already seeing that data trend that I mentioned, that cases this year for Lyme disease as compared to last year are much higher. So this is Lyme disease data, and this is anaplasmosis data. So I guess, Jessica, do you want to do that poll?
Yes, I will launch that now.
Do I need to stop sharing, or, oh, here we go.
Nope, you can go ahead. We'll give it a minute or so and then see where we are at.
as you know, in public health, we just love data. So I thought this is a great opportunity to get a little data on, um, possible prevalence, incidence, etc.
So it looks like we're almost there with everybody answering, so I'll give it another couple of seconds. Okay.
All right. That looks about right to me in terms of Lyme disease is the most common tick-borne disease. So we have 17% of our people on the call have been diagnosed with Lyme, at 8% other, and the rest no, the lucky ones. All right, thank you so much for that, for participating in that poll. Okay, on to our next slide. About ticks. So ticks are arachnids. They have 4 life stages: egg, larvae, nymph, and adult. And I wanted to show you what these life stages look like. Ticks require blood meals to get to their next life stage, and they transmit pathogens during the blood meal. So as compared to the size of a dime here, this is the black-legged tick, Ixodes scapularis, which is kind of the most common one you're going to see, and the one that transmits Lyme disease. So this is the tick without any blood meal, and then over here we have what it looks like when they start to feed, and they get progressively more and more engorged. And this is after 7 days of, this. You hope that a tick is not attached for 7 days, but sometimes you see, I see this on my dog actually, who goes outside a lot. There's often ticks like this size on her. I did include a link on this slide to a real interesting website, Tick Encounter, that actually collects data from anybody. If you want to send a picture of your tick and where it was on you and what it looked like when you pulled it off, this Tick Encounter website will accept that data and will add it to their kind of catalog of information about tick encounters. So what to look for? Ticks can be different sizes depending on their stage of life. Nymphs, so that stage that I just showed you between like the egg, the larvae, the nymph. The nymphs are the most likely to find a human host and the most difficult to spot because of their size and the most likely to transmit infection. So these guys are just tiny, and I wanted to show you what it looked like on a person. So here's like the person's belly button, and that's a nymph attached with a little bit of local reaction around it. And this is again from one of those websites. This was a tick that was attached 1 day engorged in Maine. And nymphal ticks are active mid-May through mid-July. After I added this to the slide, I thought, well, I should have pushed it back to April because we are seeing now this kind of activity in April. Here's a couple of pictures here of what different ticks look like. These are the ticks responsible for the majority of human infections. And like I said, the black-legged tick is really the main one you're going to see. It's also called the deer tick, and it causes Lyme disease, anaplasmosis, babesiosis, and Powassan virus. There's the American dog tick, which can cause Rocky Mountain spotted fever, and the Lone Star tick, which can cause ehrlichiosis or alpha-gal. And Lone Star is called that because of this little spot right here on their back. One tick can carry multiple infections, so this gets a little complicated. Basically, when you have symptoms of a tick-borne illness, you want to be seen by your provider and tested and treated as soon as possible. What's the health department's role in disease surveillance? So the tick-borne diseases are reportable to the health department for data surveillance purposes. We just kind of want to know what it looks like out there so we can inform people of their risk and provide education. In New York State, the following tick-borne diseases are reportable: Lyme disease, anaplasmosis, babesiosis, ehrlichiosis, and then these two that are very, very rare: Rocky Mountain spotted fever and Powassan virus. If you test positive for one of these diseases, you may be contacted by a public health nurse for a follow-up investigation. And with the caveat that there's so many cases of Lyme disease that we can't call everybody who has Lyme disease. But we're focusing more on the ones that have lower numbers, like anaplasmosis and babesiosis. We do follow up and usually try to get from the person where they think they were when they encountered the tick, and collect a little more information about their particular disease course. And I showed a map here of Lyme disease incidence in New York State. The darker the color, the higher the rate. So Tompkins County is right, I believe we're right there. So we are one of the darker ones that we do see pretty high rates of Lyme disease. I wanted to just touch on this fairly new addition to the tick-borne diseases that has been showing up more in data recently. This is called alpha-gal syndrome, or red meat allergy. It's usually caused by a bite from the Lone Star tick, and the tick releases a molecule into the bloodstream. The person's immune system reacts to that molecule, and it causes like an allergic type reaction. So then later, when the person eats meat from a mammal or other food products that contain alpha-gal, they may have sort of like an allergic type reaction. Right now, it's not reportable or notifiable in public health. There's a lot of discussions going on about making it more reportable, but because it's kind of like an allergic reaction as opposed to a tick-borne illness, it's a little bit in this gray area of reportable diseases. And just a little bit more data on alpha-gal. We are seeing increased positive test results, and the number of new suspected cases increased a lot there was a study during 2017 to 2021 that really showed this increasing. And if you zoom in on New York State, you'll see again, we have Tompkins County is that little darker color in there, which shows a little bit higher incidence of this. I also wanted to include some information about local tick surveillance and testing. New York State Department of Health actually has people going out to local parks and collecting ticks and then testing the ticks to see what diseases they carry. So they do it once a year, and they do it at Robert Treman State Park locally. And they collected 50 of the black-legged ticks, the deer ticks, the Ixodes scapularis. And from the summer of 2025, 27 out of the 50 were positive for the causative agent of Lyme disease. 4 were positive for the presence of anaplasmosis. 11 were positive for the presence of babesia, or the causative agent of babesiosis. And there were 0 out of the 50 positive for Borrelia. So that's a little bit nerdy behind the scenes stuff, and those numbers are just representative of those 50 ticks that they happen to collect. But it just gives you an idea of, when there's a tick crawling on you, sort of like maybe a 50% chance that tick is carrying Lyme disease based on some, limited surveillance that's been done so far. So how do we prevent ticks from biting and from transmitting disease to people? I really liked this analogy that New York State Department of Health recently provided during a presentation. it's really good to take a layered approach. There's no one magic thing that's going to prevent all tick bites, but if you do all four of these things, you have a much better likelihood of avoiding a tick bite. So the first layer is clothing. You want to, we'll go through all these one by one. You want to use repellents. You want to make sure you're doing certain behaviors that will not bring you in as close contact with ticks. And then you always want to do a tick check after being outdoors. So step one, clothing. Wear clothing to help see ticks and prevent tick bites. Light colored clothing, ticks are dark. They're like a dark brown. And if you're wearing like a light brown, sort of khaki, like in this picture, you can actually see them crawling on you a little more easily. You want it to be a tight weave material. Long sleeve shirt and pants. So this is, hard to do when it's hot outside, but it will protect your skin a little better. Something breathable. And tuck your pants into your socks. This helps to really create a nice barrier so the ticks can't crawl up your legs. You can also treat your clothing. So this is something where, if you're trying to avoid having a lot of like insect repellent on your skin, it doesn't necessarily feel great to be constantly spraying yourself with insect repellent. You can spray your clothing. There's a link here to a CDC site with more detailed instructions, but basically you can treat your clothing with permethrin and it remains protective through several washings. You can also buy clothing and gear that has been treated already with permethrin. So just make sure you're reading the label instructions, you're applying it in a ventilated area and hanging it up to dry. Okay, actually, I think we were going to stop and do another poll here. I'm curious to hear from people what repellents they use.
Yes, I'll get that started here.
Okay, thank you. Yeah, so this is again just an opportunity to kind of sample the crowd. What's out there? What do people like to use for tick repellents?
Looks like we're just over 50% answered. And for any questions that do come in through the chat, we will look at those at the end. All right. So it looks like almost everybody is answered, so I'm going to go ahead and end the poll and share results for you there.
All right. Yeah, so 60% of people here are using DEET, and some people use Picardin, and some people don't use any tick repellent. So, okay. Well, thank you for sharing. We're going to talk a little bit more about all the options here. So the recommendation is to use EPA-registered repellents that contain either DEET, Picardin, or this somewhat obscure one that's called IR3535. For those of you that know about that, I think it's Avon Skin So Soft bug repellent. That's the IR3535 is in that Avon Skin So Soft bug repellent. So you should read the label, as with everything that you're putting on your body. Not all repellents that work for mosquitoes work against ticks. Make sure that it's approved for use for ticks. Avoid using repellent on eyes, nose, mouth, cuts, open wounds, and avoid using products that don't contain EPA-registered ingredients. I did want to just address some alternative repellents and whether DEET can be used on children. It is safe to use it for children with no age restriction, but you can use a lower concentration. So per the American Academy of Pediatrics, the concentration of DEET affects how long it will be effective. So you can choose a lower concentration. If you're only going to be outside with your kid for an hour or two, you can use like a 10% DEET. Higher concentration works for a longer time, but anything over 50% doesn't provide longer protection. So just know that. And then natural repellents like essential oils, they're safe, but they haven't really been shown to be effective. So just in case you're interested in those, they only keep insects away for a very short time. If there's no concern about getting a serious insect-borne illness, you might want to use that. But I would say around here there is a concern, and you want to use something that's been shown to be more effective against tick-borne disease. And then we get to that next layer of protection, behavior. Stay on marked trails as much as you can. Ticks will cling to tall grass, brush, and shrubs, and quest, and that word is in quotes there because that's kind of a thinking about insect behavior. The ticks send out their little front legs looking for, a host to bite. So that's called like a questing behavior in ticks. They're kind of like, where is there blood around here that I can start eating? They live at the edges of woods, around old stone walls, and in leaf piles. Walk in the center of trails and avoid dense woods and bushy areas. I also wanted to include a little info about reducing tick habitat at home. So for people that have access to a backyard or own some land, and you want to enjoy being outdoors without constantly feeling like you have to suit up and, all this gear and spray. Ticks are found in cooler areas where trees, brush, leaf litter, and tall grass provide cover. Ticks generally avoid heat and direct sunlight. So keep your grass short. Don't let piles of brush or leaves build up. You can also kind of reduce the tick hosts from coming into your yard. So you want to try to keep deer out. Place bird feeders outside your tick safe zone. So birds are actually hosts for ticks. Create a barrier. So ticks don't really travel very far. Like they're not going to like walk for long distances of time. So if you create this barrier of like stones or mulch or something, they're not going to walk across like 3 feet of just that because it's too long of a journey for them. Plant shrubs and other plants that deer do not like, such as ferns and plants with strong scents. So just in case, this is helpful for anyone, it is a way to make your backyard less tick friendly. And then we get to the tick checks. Once you've been outside, maybe you've been camping, maybe you've gone on a long hike, and you come back indoors. You want to make sure you check yourself, your clothes, your pets, and your gear. And I included here a graphic from CDC again about where to check your pet for ticks. Basically, all those sort of blood-rich areas, ticks and like crevices, ticks like to attach in like an area that's kind of like a little bit harder to get to because then they might escape being, removed by the host. After you're coming home, check your clothes, put your clothes on the dryer on high heat. That's an option to get rid of all the ticks. And you can do a tick check in the shower. You might need to use a mirror to help see all the areas on your body where there could be a tick. What should I do if I find a tick? So you want to remove it promptly with a pair of fine-tipped tweezers. And I really do want to emphasize the fine tip here. If you can find like a set of tweezers that just has really precise, long, almost needle-like, pointers, those are really going to be helpful for getting those tiny, tiny ticks, especially the nymphal size. Wash the site thoroughly with warm water and soap or an alcohol swab, and then you want to monitor that tick bite, the area where the tick was on you, for 30 days. And then call your doctor if you develop a rash or flu-like symptoms, fever, headaches, joint swelling, etc. And this is a picture of what this bullseye rash looks like from a tick bite. And this is a clinical indicator of Lyme disease. A little more detail on how to remove a tick. You basically want to grasp as close to the skin surface as possible and pull upward. You do want to avoid twisting. I know there's a lot of products out there called like tick twisters. Those can kind of mash the tick and leave parts in the body that you don't want. So you really want to be as precise as possible with tweezers and pull straight up. There is a video here linked from New York State DOH that goes through how to remove a tick in more detail that you're welcome to watch at a later point, or we can put it in the chat for you. There's some recommendations here on what not to do as well. Some people want to try to use soap or rubbing alcohol to try to drown the tick or try to burn it off with a match. Don't do any of those things. You could risk obviously burning yourself. And ticks can stay on through being like wet. So you really need to actually just take the tweezers and pull straight out. Should I have the tick tested? So generally, it's not recommended to send in the tick for testing, and there's several reasons why. Just because the tick tests positive doesn't mean that they actually transmitted the disease to you. It depends on how long they were feeding, how engorged they were, a whole variety of factors. You may have symptoms of tick-borne illness before the tick testing results are back. Testing does not cover everything that ticks can carry. Positive results on the tick doesn't mean you're infected. You can be bitten by another tick before results are in. So there's just a whole kind of host of reasons why. Generally, you want to pay attention to your own symptoms and seek care if you do develop symptoms. And then this slide talks about our role in the community for tick bite prevention. We do a bunch of things to try to get the word out to our community, our county residents, how to prevent tick bites and tick-borne disease. We've done a couple events at the Science Center, Tick Talk. So there's a picture over here of that happening. I think it was probably last summer that we did these. We also do a lot of outreach events, and like you might see us at the various festivals around town, street fairs. We hand out these little cards, information cards on what to do, how to prevent tick bites, just to try to make sure everyone's aware and that we're doing the best we can to reduce this illness in the community. All right, so that's all that I had for today. So I'm happy to take questions from people. I think there were some questions in the chat.
Yes, I would be happy to read those to you.
Okay.
Some questions and some comments. So the first poll about if you've been diagnosed with tick-borne disease, someone said, I'm a no, but my dog was just treated for anaplasmosis. And someone found a tick exactly where it was on the picture. One of the questions for the information, is this based on residence location or where they are treated by provider?
Yeah, great question. So when we get lab results for county residents, it's based on the address that the person gives when they present for care. So if you go to like an urgent care, and they ask for your information at the beginning of your visit, whatever address you give, it goes to that county for results. So yeah, so it's not where you're treated, it's the address that you as the patient are giving to the provider when you show up.
Okay. Then another comment, my friend in Southern California has alpha-gal.
Yeah.
A couple of them separate go together. Please address pets bringing ticks into the home. And then it says, my dog came into the house last year with quite literally thousands of tiny ticks on his head. I picked and picked, but are there better methods of removing these clusters?
Yeah, that's really a tough one. So pets bringing ticks into the home, actually, you can make sure that your pet is on a tick preventative. There's like a monthly pill that they can get from the vet that actually is preventative. Um, it's I think it's for ticks and for like heartworm. I'm not a veterinarian, so I don't know for sure on all of this, but I know that I give my dog that. Also, dogs can get the Lyme disease vaccine. There is a vaccine for dogs. There's not a vaccine yet for humans. The human vaccine, actually, there's been some clinical trials going on, and we might eventually have one for humans. But I would say talk to your vet about prevention for your particular pet. Um, and for those clusters, you know, um, quite literally thousands of tiny ticks on his head. Um, yeah, I think because of what we just talked about, taking them outside and spraying them down with a hose is not really going to help. Those ticks, I guess if they're not attached yet, it might help. If they're attached already, it doesn't really help. So I think honestly, it really does have to be kind of like a taking a look and pulling them off one by one. I don't know of any other method.
Okay. Um, how effective are tick tubes at preventing ticks on your property?
Yeah. Yeah, so there was a big focus on tick tubes. I remember this maybe 5 or 10 years ago. They were putting out all these instructions, and then it was sort of found that those contribute to like pollution generally. I mean, like you were just finding bits of like, toilet paper tubes and like stuffing, and it was just kind of like this is actually kind of littering the environment, and it might not actually work. So the tick tubes are supposed to target mice as a host. So the thought was that mice would then, use that as part of making their nests. And then there was, the stuff in the tick tubes was soaked with like a tick repellent or, some kind of something to kill ticks. Generally, you can treat your property. That's something that's possible. You can actually apply like a repellent pesticide type thing to your property to reduce ticks. And I know some like daycares in the area or outdoor children's camps that are really trying to get ahead of ticks, choose to make that decision to treat, their lawns as much as possible to try to get rid of this. So I would say, right now the tick tubes really, they've kind of fallen out of favor a little bit. You can try to make your outdoor space less tick friendly through the things that we talked about. You can treat with like a pesticide. And reducing mouse habitat is another great thing to think about because mice are the hosts for ticks.
You kind of touched on it a little bit, but there was just a question about the tick twister. So I'm not sure if you have
Yeah.
anything more to say on that.
Yeah, just that, the official advice from New York State Department of Health is just to use tweezers and to pull straight up instead of twisting, because twisting can kind of break the tick and can leave some mouth parts within, like that are already kind of inside inserted. So as much as possible, if you can just use fine tip tweezers and pull straight out, that usually is a more effective way.
Great. Um, I'm not totally sure on the pronunciation of this next word. Is diatomaceous earth effective against ticks?
I have not heard of that one for ticks, and that might just be that I didn't come across that in my research for this. It's not something that's been recommended by the sources that I turn to, which is New York State Department of Health, CDC, EPA. I know diatomaceous earth is recommended, I think, for bed bugs, if I'm right in that. But I can get back to you on that one. I can do a little more research and let you know.
Okay. And then it looks like the last question. Last month I had a tick in my abdominal area. Should I seek testing even though I didn't get a rash or experience symptoms of disease?
Well, you did all the right things in terms of monitoring yourself. I would say if you didn't experience any of that, it's likely that you didn't have the tick that was on you wasn't on long enough to transmit disease. You're certainly always welcome to check in with your provider on these kinds of questions and see what they say. But I would say if you had no symptoms, no rash at the site, that generally that's a good sign.
Like this was helpful, thank you. No other
Mhm.
questions have come in a while, so I think that's it. Obviously, if there's anything more, we can reach out. Thank you, Rachel, and to everybody who joined today. Once the recording is available, we will send that along with the slide deck out.
All right. Thank you so much, everybody.
Thank you. Have a great day.
You too.
Bye.